In order to release the sacrum from the sacroiliac joint, to release tailbone pain syndromes, and to do a Releasology butt lift, let me show you how to release the glutes, the deep rotator muscles, and the pelvic floor muscles. Gluteus medius is the strongest muscle attached to the SI joint on the outside, to the ilium, and the gluteus maximus is the strongest muscle attached to the sacrum. So between the two, when those two muscles are tight, it pulls on the sacrum and the ilium at the same time, and that can shift the sacroiliac joint and put undue tension and cause pain inside that joint. So releasing the gluteus muscles also releases the sacroiliac joint besides releasing the tailbone. First, let me show you the Releasology technique for the gluteus medius. The gluteus medius abducts the femur, and the nerve that goes to it is called the upper gluteal nerve, or the greater gluteal nerve. To release it, the gluteus medius, you have to stretch it. So you want to be able to stretch the muscle in an adduction direction. So you have to push the thigh towards the other thigh to stretch it, and with one hand. And with the other hand, you have to form a phalanx kind of position with your fingertips and do pressure point release right into the middle of the muscle, which takes off of the, from the ilium, from kind of the top of the ilium, and drops down to the greater trochanter, which is the bump on the outside of the femur where it attaches. So I'm just kind of showing you the line of the muscle here and getting situated. So let me go ahead and show you how we do this. My fingers are just about in the right position for doing the stretch and for doing the pressure point release. So let's go ahead and lay into it. Go ahead and watch for a second. See, I'm stretching the leg, pushing the leg bone towards the other leg bone. And while I'm doing that, I'm feeling the actual gluteus medius stretch with under my fingertips on the upper part where I'm feeling the pressure points. So I'm slowly increasing my pressure, still increasing my pressure, and now I'm going to really lay into it. So I'm actually pushing from a kind of a martial arts stance on the ground where I'm standing, and through my body, straight into both hands, about equal pressure into both hands, but I'm really pushing hard into my fingertips. And I'm definitely feeling the stretch with the lower hand that's stretching the thigh towards the other thigh. So a lot of stretch, a lot of pressure, intensifying right into the tightest fibers of the gluteus medius. And now I'm going to slowly start backing my pressure out, making it feel like I'm backing out, even though I don't really go anywhere for a good 60 seconds. So slowly backing my pressure out, making it feel like I'm backing out, and I feel like a release just happened. Do you see that? So the muscle just kind of softened up. It's because I felt a release. So let's try again. The gluteus medius is a large muscle, a lot bigger than other muscles we've been working on. So let's try different sections of it. You do the yang and yin pulse just like I did. Do it a few times, and definitely do it until you really feel energy going through your body. Repeat it until you get the whole gluteus medius to release. By releasing the gluteus medius, you definitely allow the sacroiliac joint to line up again. So did you know that you can get a butt lift by releasing the gluteus maximus muscle? The gluteus maximus, right where it attaches to the sacrum, can get really, really tight and pinch its own nerves. When it does, it loses tone and it drops and becomes flat. By releasing the muscle tension around the nerve outlets, right where the gluteus maximus attaches to the sacrum, you can increase the tone of the butt and really make it lift up. Okay, let's show you the gluteus maximus. The gluteus maximus is the strongest muscle in the body. It's strong enough to propel us upstairs to, when we jump or run. The gluteus maximus is giving us most of the power. It's a big giant muscle, look at that thing. And the sciatic nerve travels under it. And it forms into the IT band, the tendons of the gluteus maximus, and that goes down to the knee. It attaches to the tibia ultimately. And right where I'm pressing is close to the attachment of the gluteus maximus onto the sacrum, and that's where the gluteal nerves come out. So those nerves, if they're pinched because the gluteus maximus is too tight right where I'm pressing, those nerves get compressed and someone could really lose tone in their butt. I've seen it happen before with weightlifters where the gluteus maximus gets so locked up right there that it actually pinches the gluteal nerves. So by doing this, you can release the gluteus maximus right where the nerves come out. It makes it both stronger and it makes it look a lot better. I've seen butts that were flat, puff up just by releasing the outlets here. So it's a way of increasing the strength and making the butt look better. So did you see how I did that? What I did is I just went straight into the attachment, forcing a stretch with the muscle while I was pressing into it. towards the attachment. And I'm just doing it until I feel like it can release, and then slowly backing my pressure out and triggering a release. When it releases, I feel like it really melts. So let's show you how to do the IT band release, because the IT band is basically the tendon for the gluteus maximus and the tensor fasciae latae, a muscle that's in the front of the hip, and the gluteus medius forms the core of the IT band. So you even help the gluteus medius by releasing the IT. The iliotibial band is the basic tendon, or it's not exactly a tendon, it's called a band because it has different fibers in it. Most of the fibers are tendon fibers, but it basically serves as the tendon for the gluteal muscles. For the tensor fasciae latae, which anchors the IT band on the front of the body to the iliac crest, and the gluteus medius forms the core of the IT band, although none of the fibers contribute to it and contribute to the IT band. And there's the gluteus maximus. The gluteus maximus is a giant muscle that comes from the tailbone and from the sacrum and a little bit from the edge of the ilium, but not much, just a few fibers. And all those fibers converge and form the iliotibial band, which travels down the side of the leg. Most of the bulk of the gluteal muscles is in the back, in the maximus, and the attachment of the iliotibial band is onto the tibia in front of the tibia. So the muscle, the gluteals, when they pull from the back and they tense the IT band, it begins to rotate the tibia to the outside. It's not restriction of the knee in terms of being able to flex your knee that causes knee pain. It's when the knee starts to rotate. When I mean knee is when the tibia starts to rotate, because the iliotibial band is tight. So I've shown you how to release the gluteal muscles in the last few videos. So let me go ahead and show you a little bit more on just the IT band and watch my manipulations specifically for releasing the knee. Okay, so go ahead and check it out, and you can complete the course by doing all the drawings for all the muscles and taking photos, sending them to us, and videotape yourself doing the techniques. And then at the very end, try all these techniques on somebody that has knee pain and get a video testimonial from them. And you could even videotape how far they can bend their knee before and after your treatment. So good luck, and I'll talk to you on the other side of this. Now we can talk about the knee. So the knee, basically, usually when people have knee pain, it's caused by the same mechanics. It's when the IT band gets tight and it laterally rotates the tibia. That offsets the knee, so when your weight comes down into the knee from the body into the femur, if the tibia is laterally rotated, there's nothing under the knee to support the weight of the body. So the tendons freak out and get tight, and the ligaments get stressed and can actually shear and tear. So you want to release the IT band. This allows the tibia to come back under the femur so that the knee can be aligned properly. And the stroke I'm doing is the way to lengthen it out. It's kind of imagine like dough, making the dough lengthen out longer and longer. When the IT band gets long enough, then the tibia gets to be able to roll around, so it comes back under the femur. Imagine that the lower leg rolls like a rolling pin, and with kind of the way it's laying there, and when it rolls under or back, it's because the IT band is tight or loose. Imagine the IT band comes around to the front of the tibia. When the IT band's tight, it rolls the lower leg to the outside, which points the foot to the outside like a duck. And when you release it, the foot should start to point back to the inside. That means that the tibia is rolling back under the knee where it's supposed to be, and knee pain will be corrected. This actually takes undue tension off of the ACL, or the anterior cruciate ligament is the main ligament inside the knee that can tear, especially from athletic injuries. And the reason it usually tears is because the IT band is tight. So you want to do this to take tension off of the ACL. This prevents tearing of the ACL. I honestly think that in most ACL tears, if the IT band were released first, the ACL tear never would have occurred. So see how I got the stretch going with the one hand? I'm balancing the leg, and with the other hand I'm going in and I'm doing yang-yin pulses to get releases in the IT band wherever I feel the tightest fibers. It's a wide band, so it's not necessarily that the whole thing is tight. It's usually certain fibers are tighter than other fibers. So that's what I'm doing, is I'm finding those tight lines of tension, running through the IT band and doing yang-yin pulses to release it. And I can actually see the tension in the outside of the thigh starting to drop. You see the tibia it's rolling back around. Oh, look at the foot. See her foot starting to point down towards the table more easily now. Let me try a little bit more. Usually I try the releases out in the middle of the IT band like I just showed you, and then I migrate my technique down towards the knee. So with the fingertips of both hands, I'm really zeroing in on the IT band and stretching it towards the tibia. Imagine that I'm trying to roll the tibia so that the foot points even more under towards the table with that stretch point release. Yang yin pulses, and that's how you do it. So that's how you fix a knee, and it usually works. Give it a try, and I'll catch you on the next video. Make sure you do the drawing so you know where the muscle and the muscles that come into the IT band are and where the IT band actually is.